Kwashiorkar, a severe form of the protein energy malnutrition primarily affecting the children, caused by the deficiency of the dietary protein. Inadequate protein intake, despite the sufficient caloric intake, typically occurs during the weaning or in the children whose diets are predominantly carbohydrate based. Reduced protein synthesis impairs the plasma protein levels, leading to the hypoalbuminemia. Hypoalbuminemia causes a fluid retention in the interstitial spaces, resulting in the edema. Impaired lipoprotein synthesis leads to the fatty liver. Edema. Pitting edema starting in the feet and progressing. Growth failure, stunted growth and the muscle wasting. Dermatological changes like a flaky paint, dermatitis, skin depigmentation and the desquamation. Hair changes like thin sparse hair with alternating bands of pigmentation, flag sign. Liver enlargement like a fatty liver, hepatomegaly. Behavioral changes like apathy, irritability and the lethargy. Immunosuppression like increases susceptibility to the infection. Gastrointestinal symptoms like diarrhea and anorexia. Diagnosis like clinical evaluation of the symptoms, laboratory findings like hypoalbuminemia, anemia, elevated liver enzyme. Treatment initial phase, treat the infection, correct dehydration and the electrolyte imbalance, and stabilize the metabolic function. Rehabilitation phase, gradual reintroduction of the protein-rich foods and the calories, vitamin and the micronutrient supplementation, psychosocial support for the long-term rehabilitation. Kwashiorkar, this is a protein deficiency disease with adequate caloric intake. Characteristic features like edema starting in the feet. Hypoalbuminemia, this is the primary cause of the edema. Fatty liver is due to the impaired lipoprotein synthesis. Skin changes like the flaky paint, dermatitis and the depigmentation. Hair changes like flag sign, alternating the pigment and the depigmentic bands. Severe cases can lead to the immunosuppression and the recurrent infections. Common age group like children aged 6 months to 3 years during or after the weaning. Diagnostic relies on the clinical signs and the low albumin. Immediate treatment focuses on the stabilization and the correcting the deficiency. Rehabilitation involves the protein reintroduction and the balanced nutrition. Complications include the secondary infection and the long-term developmental delays.